So we've heard of laser treatments and we've heard of lipo, but have you heard of laser lipo? That's right, it's a lesser known option out there that can sometimes be done without going under the knife and with less recovery time than traditional liposuction. But does it really work, and how do you know if you're a good candidate? Here to break it down for us is cosmetic surgeon Dr. Cameron Rokhsar. Dr. Rokhsar, thanks so much for coming back on the show.
Good morning, Tanya. Thanks for having me.
So maybe you can tell us a little bit about this laser lipo. I understand that there are different versions of it, so to speak, right?
Yeah, the whole idea can be broken down into two categories. One is laser contouring, and the other one is laser-assisted liposuction. Just, to get back in terms of liposuction, liposuction is a technique where we're able to basically suck fat cells out. In tumescent liposuction, we infiltrate areas that we're working on with a dilute numbing solution, and we go through tiny cannulas and we suck the fat out. The whole idea of laser contouring or laser-assisted liposuction is, well, let's try to melt that fat down beforehand through a laser. So what we do is we get a laser cannula and we insert it into the areas we're going to suck the fat out. And if you combine it with liposuction, that's called laser-assisted liposuction. Now, in certain individuals where they're very thin and they just want, mild body contouring, you really don't need to suck fat out. So all you can do is just insert your laser cannula and just liquefy or melt some fat to contour that area.
And then where does that fat go?
Yeah, that fat gets absorbed by the body.
Oh, interesting. It almost sounds too good to be true. Does it actually work?
It does work, but you have to have realistic expectations if the only thing you're doing is laser contouring. So it's really not meant to really cause dramatic differences. However, when you combine it with true liposuction, meaning that when you suck out that liquefied fat, the results are definitely much more enhanced.
So for the laser option, are we talking, when you talk about minor differences, are we talking about supermodels that come in for a tiny tune-up?
Well, certainly there are individuals who come in, to get rid of tiny areas,
right.
and those are ideal candidates for just laser contouring. Now, if you're a little heavier and if you need there are certain areas of fat that are diet and exercise resistant, we can use the laser to kind of make the procedure faster, as well as to make the downtime less. Because what the laser offers really several-fold. One is that the heat of the laser coagulates blood vessels.
Okay.
So as such, when you're coagulating blood vessels, there's less bleeding. So when there's less bleeding, there's less bruising. When there's less bruising, there's less downtime. So that's kind of one general advantage of it.
So tell us a little bit about the downtime. How does it differ from traditional liposuction?
Tumescent liposuction kind of revolutionized traditional liposuction. Tumescent liposuction basically transformed liposuction from a procedure that's done under general anesthesia with 1 to 2 weeks downtime to a procedure where it's only 3 to 5 days downtime, where it's done under local anesthesia.
That's a significant difference.
Right. So, and then the laser adds an additional benefit of further coagulation. So, the downtime could be anywhere from 1 to 3 days.
Depending on how large the procedure is?
Exactly, depending on what large surface area you're treating and so on and so forth. Another advantage to laser liposuction is that the heat of the laser actually is able to contract tissue underneath a little bit. So you get a certain degree of skin tightening that's an additional benefit to traditional liposuction.
So if you have a little bit of flabby skin, you might see a little tightening there as well?
Exactly. So for example, a very nice area for this procedure happens to be the neck. In the neck, as we get older, some people develop some fat, but at the same time, we have some skin laxity. So if you kind of use the laser to kind of tighten the skin from underneath, actually get nice dramatic results in that area.
What about the abdomen? Because that's another place where the skin can get a little flabby after pregnancy, especially.
Absolutely. The skin happens to be a fantastically dynamic organ. The skin has this amazing capacity to stretch as well as to contract.
Yeah.
So when you apply a little bit of heat to the skin, you're able to really get nice contraction, and that's kind of the principle behind a lot of new innovative cosmetic skin tightening procedures with various devices.
What about pain? Is there pain involved? Is it less than with traditional liposuction?
The pain is less, and the reason for that is that you're using smaller cannulas. So with the various devices, I use something called LipoLite, for example. It's a ND-YAG device where you use a very small cannula. So when you're using smaller cannulas, there's certainly less pain. I mean, the whole procedure at this point is really done under local anesthesia.
It sounds like there's no reason to do traditional liposuction. What you're describing sounds like a win-win situation. Is it only if you have larger areas that you would do traditional liposuction?
By traditional liposuction, we mean to suction fat out.
Right.
So I always like to combine for people who need more dramatic results to actually suction fat out in addition to using the laser at first.
Okay.
And then we get to a different topic of large volume liposuction, which I'm not a proponent of. And there are people that use liposuction as a weight loss type of procedure. I'm not for that, because those are the people who run into trouble, and those are the people who have side effects and potential, things like death and things have been associated with large volume liposuction.
So who's a good candidate for liposuction of either variety?
A good candidate for liposuction is really somebody who has a healthy lifestyle, who diets and exercises, and who's looking to contour diet and exercise resistant pockets of fat. And in men and women, we have different areas that bother us. Men always complain about love handles genetically. They could be very thin and fit, yet they have love handles. Women, for example, complain of big hips or big thighs. So really, liposuction shouldn't be viewed as a procedure that's meant to be used for weight loss purposes. It really should be viewed as a procedure that's used for body contouring and to change the shape of an individual. And fat weighs very, very little, actually. Right. So when you actually do liposuction or liposculpture or laser contouring, you do lose inches, but you really don't lose a whole lot of weight.
That's right. Now, in your opinion, has the laser contouring come a long way? Because I remember it's been out, what, for about 3 or 4 years now? At the beginning, people were saying they didn't really see a big difference.
Yeah, it's very operator dependent, and it's also, if you're just going to use the laser, you really have to have the right candidate and have realistic expectations. You're not just going to do laser contouring on somebody who's looking to lose many inches. You really have to combine the laser procedure with traditional liposuction to suck some of that liquefied fat to get the more dramatic results.
Dr. Rokhsar, thank you so much. Fascinating discussion. And for more information on laser lipo, check out the health page at abcnews.com.
ABC News Now. Good to know.